What your period blood color says about your health doctor explains every shade of your menstrual cycle. Ladies, let's talk about something that half the world experiences, but few ever truly understand. Your period blood. Have you ever looked at the color of your menstrual blood and wondered, why is it darker this time? Or why is it pink or brown? Today, I'll break down every shade your period blood can have, what it means for your body, when to relax, and when to pay attention, because your period isn't just about bleeding. It's your monthly health report card. Before we begin, please click the like button. Subscribe if you love learning about your body, and share this with your sister, daughter, or friend, because this knowledge can save lives. Segment 1. The science of period blood. Your menstrual blood is not just blood, it's a mixture of uterine tissue, mucus, and blood cells. Every month, your uterus builds a soft lining, the endometrium, in preparation for pregnancy. When pregnancy doesn't happen, hormones drop, that lining breaks down, and your uterus sheds it through the vagina. That's your period. Now, the color of that blood depends on how fast or slow it leaves your body, how much oxygen it's exposed to, and what's happening hormonally or medically. Stay with me. I'll show you how to tell what's normal and what's not. And by the end of this video, you'll understand your period better than ever before. Segment 2. Bright red blood. Let's start with bright red period blood. This usually means fresh blood. It's coming straight from your uterus at a steady pace. You'll see this mostly in the early days of your period when your flow is heaviest. It means your uterus is healthy and your cycle is active, a good sign of normal menstruation. However, if your bright red blood lasts beyond 7 days or is accompanied by clots or dizziness, it could suggest fibroids, hormonal imbalance, or bleeding disorders. So, if you're changing pads every hour or passing large clots, don't ignore it. Visit your gynecologist. Hit the like button if you've ever wondered what your period color means. And let's keep going deeper. Segment 3. Dark red or brown blood. When your period blood looks dark red or brown, that's older blood. It's been sitting in the uterus for a while before coming out. It's common at the beginning or the end of your period. Totally normal. What happens is simple. As blood sits longer, it reacts with oxygen. It oxidizes, turning dark. However, if you notice brown discharge between periods, it could mean retained tissue after a miscarriage or abortion, hormonal imbalance, infection. So, note the timing. If it's at the start or end of your period, relax. But if it's random or smelly, seek help. Ladies, type healthy. Cycle in the comments if your period usually starts or ends. Brown, let's normalize these conversations. Segment 4. Black blood. Black period blood might sound scary, but it's often just very old blood. It's been inside the uterus longer than usual, so it turns dark brown or black before coming out. You might see this after a delayed flow or when your period starts late. But, and this is important, if it's accompanied by pain, fever, or bad odor, that's a red flag. It could mean infection, retained products, or even blockage in the cervix. Always pay attention to how it smells and how you feel. A healthy period shouldn't have a foul or fishy odor. Comment, got it. If you've ever seen dark blood at the start or end of your flow, now you know why. Segment 5. Pink blood. When your period blood looks pink, it's usually mixed with cervical mucus or lighter discharge. This can happen at the start or end of your period, during ovulation, or if your estrogen levels are low. Other times, pink spotting can mean anemia, low blood count, nutritional deficiency, or early pregnancy implantation bleeding. So, if you're getting pink spotting frequently, especially if your period is getting lighter, talk to your doctor. You might need a hormone check or diet adjustment. If this is new to you, share this video with another woman. She might need to hear this today. Segment 6. Orange blood. Orange period blood? That one raises eyebrows, and for good reason. Sometimes, orange blood just means your blood mixed with cervical fluids, giving it a lighter shade. But if it's bright orange with a foul smell or discomfort, It could be a bacterial infection like bacterial vaginosis or an STD. So the rule is simple. No odor plus no pain equals probably okay. Odor plus irritation equals see your doctor. Ladies, please, don't self-medicate infections. Let a qualified health worker guide you. Segment 7. Grey or milky blood. Grey or milky discharge mixed with blood is not normal. It can suggest bacterial vaginosis, yeast infection, or in pregnancy, it can mean a miscarriage. If you ever notice grey tissue or foul-smelling discharge, seek medical attention immediately. It could be a sign of infection that needs treatment right away. Remember, early treatment prevents complications. So, don't wait till it gets worse. Segment 8. Why color changes matter. Your menstrual color changes are reflections of hormonal balance, flow rate, uterine health, and sometimes stress or diet ***. A healthy menstrual cycle is a sign of overall health. If your color, timing, or pain changes suddenly, your body is waving a flag for attention. Listen to your period. It's one of your best diagnostic tools. If this information has opened your eyes, tap the thumbs up button and share it in your women's group chat. Segment 9. Health benefits of normal menstruation. Menstruation isn't a curse, it's a cleansing process. It helps remove old uterine tissue, maintain hormonal balance, indicate fertility and ovulation, regulate mood and body temperature. A normal period shows your body's reproductive and hormonal systems are in sync. So instead of dreading your period, embrace it as a vital sign, just like your pulse or blood pressure. Say, I love my body, in the comments if you're proud of how strong your body is each month. Segment 10. When to see a doctor. See your doctor if your periods are too heavy or painful. The color is grey or orange with odor. You have missed periods for over 3 months, not pregnant. You notice clots larger than a coin. Or your flow suddenly changes pattern. These could be signs of fibroids, infections, hormonal imbalance, or even early menopause. Your period blood color is more than just a stain. It's your body's message board. Learn to read it, respect it, and act when something feels off. To every woman watching this, you're strong, you're beautiful, and you deserve to understand your body without shame. If you learned something new today, like, subscribe, and share this video widely. Together, we can break the silence around women's health and help every woman take control of her cycle confidently. This is Dr. J, your friend in health, reminding you, every color tells a story, and every woman deserves to know hers.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.